My name is Nicole Jacobson, and I am a rotating PhD student in Dr. Anka Segal's lab at SDSU, and today I will be talking to you guys about bacteriophage therapy used to treat multi-drug resistant bacterial infection. So here we have a pair of lungs, and in our lab we focus on a disease called cystic fibrosis. And what this is a genetic disorder that leads to a malfunction in the CFTR gene, which leads to an extreme buildup of mucus, thick mucus in the lungs. And this can lead to a lot of complications for the patient, which include inflammation, and more specifically for us, chronic infection. So in the lung environment, bacteria find a perfect breeding ground. There's a lot of nutrients, it's a super safe environment for them, and it leads to a lot of problems for the patient. So throughout the patient's lifetime, they're prescribed chronic antibiotics. And so antibiotics are used to combat the bacterial infection. But as time passes through the course of their life, the antibiotics become ineffective because the bacteria have now mutated and they're resistant to the antibiotics. So what we're looking for is an alternative treatment that can be used instead of antibiotics to treat the bacterial infection in the lung microenvironment. And for us, that is these wonderful viruses called bacteriophages. And so these guys preferentially infect bacteria and don't infect our cells. So it's great. They infect the bad things in the lung microenvironment, but they won't affect your cells. So over here, we have the cell surface of a bacteria. And so what the phage does when it begins infection is it uses these proteins called receptor binding proteins. And so it's going to use this protein to bind to the cell surface. So the bacterial cell has a lot of receptors embedded in the surface, and when I say receptor, I mean flagella, LPS, glycoproteins, things like this. So when the phage comes in to infect, it's going to bind highly specifically to its receptor of choice, and then it will enter the cell for successful infection. And when we're thinking about phage therapy, we need to have a couple things in mind. First of all, we want to have a couple of phages, so 2 to 3 phages, that are going to bind different receptors. So we want the phages to have different receptor binding proteins. And so in a therapy situation, let's say we treat the patient with a phage cocktail, and the first phage infects successfully. But as time passes, the bacteria is actually going to mutate and either mask the receptor or remove it completely. And so this means that this phage is now completely ineffective and it will not reach the bacterial cell. So what we want to do is create a cocktail of phages that can now infect a different receptor. And now this phage will be able to enter the cell and lead to successful infection. And a couple other great things about phage therapy is that it's actually going to decrease the fitness of the bacterial cell. And this is because the bacteria is mutating, removing receptors, and therefore changing physiology about itself that makes it less fit. And because of lower fitness, that increases the antibiotic efficiency. So this is all great, but how am I going to find the receptor binding proteins and the cell surface receptors that the phages bind to? I'm going to be using computational methods, such as bioinformatics, to determine what are these receptor binding proteins used by the phage to enter the cell successfully. And this will lead to more personalized medicine, because we can actually take sputum samples from specific patients, do some metagenomics, and find out what exactly is going on in the lung environment and what we can do to pick phages that will be the most effective in treatment. Thank you.